This week's topic is mental illness and criminal behavior. So what is mental illness? Mental illness is a disorder that impacts a person's thoughts, behaviors, emotions, and substantially impacts a person's ability to function. Criminal psychologists often prefer the term mental disorder because it wants to de-emphasize the medical model's term illness. Mental retardation, also known as developmental disability, is a cognitive deficiency as measured by a person's IQ. Mental illnesses are diagnosed using the DSM-4, which stands for the Diagnostic and Statistical Manual, and it's put out by the American Psychiatric Association. It's due for a revision that should be out in May of 2013. Schizophrenia is a major mental illness that is found in about 1% of the population. Symptoms of schizophrenia include delusions, which are gross distortions of reality. These can be bizarre and non-bizarre. Hallucinations, which usually come in the form of hearing noises or voices, but also can be visual, olfactory, tactile hallucinations also. Disorganization, which can come in the form of disorganized thoughts, behaviors, speech, and negative symptoms, including avolition, which is a lack of goals, and anhedonia, which is a lack of ability to experience pleasure, among other things. People who have schizophrenia are more likely to be a victim of crime and violence than a perpetrator. Violent behavior is slightly higher in this population, but victims are more likely to be close acquaintances and family members. When violence is perpetrated by these people, sometimes it can be more severe than the general population. Command hallucinations and poor insight into their illness and delusions of a persecutory nature tend to be a major risk factor of criminal behavior, especially violence in this population. People with schizophrenia are more likely to be a perpetrator of more petty level crimes and quality of life types of crimes. Delusional disorder is another type of psychotic illness where a person has one or more non-bizarre delusions that last at least a month, and otherwise they don't meet the criteria for schizophrenia. These subtypes include erotomatic delusions, which are the belief that somebody, usually of high power, is in love with you. These people are more likely to be involved in stalking types of crimes. Grandiose delusions, grandiose type, where the people think they're a lot better than others and are more likely to take advantage of other people. Jealous delusions, feeling like a spouse or a loved one is committing infidelity when they're not. Persecutory type, believing that other people are out to get you. Somatic type, mixed type, and unspecified. Major depressive disorder is the most common mood disorder that affects millions of people in the United States every year. A person must have a depressed mood that lasts at least 2 weeks, as well as having other symptoms that include things like hopelessness, helplessness, inability to sleep well, difficulty eating or eating too much, and sometimes suicidal thoughts. Juveniles that have major depressive disorder are much more likely to be involved in the juvenile justice system. Major depressive disorder, although not a big risk factor for criminal behavior, when we find some of the following types of crimes, we oftentimes see major depressive disorder as a contributing factor to the following: mass murders, school shootings, workplace violence, suicide by cop, and murder-suicide. Major depressive disorder sometimes is found along with manic episodes. This used to be called manic depression, now it's called bipolar disorder. Mania is a significant risk factor for criminal behavior in some cases. Mania basically is in the same category of symptoms as mental illness. Basically, mania is the exact opposite of depression. True manic episodes are found in what they call bipolar I disorder. Antisocial personality disorder is a disorder that is very highly correlated to criminal behavior. Most psychopaths will have antisocial personality disorder. To be diagnosed with antisocial personality disorder, the person must have these traits going back to at least the age of 15, in which there's usually a conduct disorder present. They must be at least 18 years old before they can be diagnosed with the disorder, and they must have at least 3 of the following: a failure to conform to social norms or criminal law as reflected by frequent law-breaking behavior, irritability or unusual aggressiveness, impulsivity or failure to plan ahead, deceitfulness, which can come in the form of lying, conning, using aliases, etc., reckless disregard for the rights of others or themselves, a lack of remorse or guilt for wrongdoings. A lot of times we see criminal rationalizations and indifference to their crimes. Antisocial personality disorder is found in about 3% of males and 1% of females. It is also found in 50% or more of incarcerated populations. It has a familial pattern, which means it runs in families. It is likely due to both nature and nurture type issues. It's very common that people with this disorder have co-occurring substance use disorders, and it also increases the risk of suicide when someone is incarcerated, or even when they're not incarcerated. The suicide rate is higher for people with this disorder. Okay, now we're going to put the antisocial personality disorder aside and focus more on the serious mental illnesses, the psychiatric disabilities. These include schizophrenia, recurrent major depression, that is of a serious quality, bipolar disorder, illnesses like that. People with those types of illnesses tend to commit more non-violent types of crimes, especially quality of life type crimes. If somebody is homeless, which there's a strong correlation between serious mental illness and homelessness, people are more likely to steal to get bread, urinating in public intoxication, the nuisance types of crimes. Nevertheless, a lot of times these folks will get caught in 3 strikes and you're out types of laws, meaning they might have 3 fairly low-level crimes, but they're locked away for significant portions of their life because they're caught again in these 3 strikes and you're out laws. These people do not commit more violent crimes than the general population as a whole. When they do commit crimes, they tend to commit crimes that are more epic in nature. We can look at the Gabby Giffords shooting, and more recently the theater shooting in Colorado. People tend to have an unrealistic fear of violence coming from people with mental illnesses, and there's just not research to show that. Again, it's when it happens, it's in the headlines. We call that the airline crash phenomenon. People who have never rode an airplane may see many crashes on TV, and when they get in an airplane, they're very safe, but at the same time they're have that thought in their head that it's going to crash, and therefore they believe that. When violence does occur, victims usually tend to be more close types of acquaintances or relatives. It's fairly rare that people with significant mental illnesses attack strangers. When people with mental illness are incarcerated, it presents a very significant problem. The incarceration has become the largest provider of mental health care in the United States, which is very sad because they're very under-equipped to handle serious mental illnesses. 16% of the incarcerated population has a serious mental illness. Prison suicide is 3 times higher than the general population. Jail suicide is 9 times higher than the general population. People with serious mental illnesses tend to break rules more, oftentimes due to behavioral implications of their symptoms. They tend to be easy targets in prison. They tend to get sicker in prison. They tend to have first onset while incarcerated due to the stressors. People with serious mental illness serve more time because of their behaviors in prison. They're more likely to be institutionalized in their thinking and behavior when they are released into society, and they're more likely to break parole. So there's a lot of reasons why we want to decriminalize mental illness as much as possible. So how do we decriminalize mental illness? Well, the first thing we need to do is improve the mental health system. We need more providers, better research, and just an overall better mental health system to care for those with mental illness. One, to prevent them from going into the criminal justice system, and two, to help treat them once they do enter and get out of the criminal justice system so they don't go back. We need to improve the education of all criminal justice employees, starting with the police, the dispatchers, and then moving into probation, lawyers, judges. There's a really good program called the Crisis Intervention Team out of Memphis, which has starting to show a lot of good research showing that it's a specific training that people who are police officers go through to learn to better deal with individuals with mental illness in the community to prevent them from escalating into having more significant problems that are going to land them into a significant hospitalization or incarceration. We need to divert non-violent mentally ill offenders from the criminal justice system to the mental health system so they can get treatment instead of punishment, because that is really what they need to if we want to really reduce recidivism. We need to establish more mental health courts. These are courts that have smaller dockets that tend to get more mental health people involved in the actual court process so they can get them into the services they need and close monitoring of their behaviors. And if they don't fulfill that, then they're going to get sentenced to incarceration. But prior to that, they're going to be treated and hopefully diverted away from a more significant incarceration. There's specialty probation programs who have smaller caseloads. They're better trained. They have a human service centered approach rather than the probation as usual. We need to change laws, especially to laws like 3 strikes and you're out, that discriminate against people with mental illness. We need to improve care in prisons and jails, a wider array of medications, physical health treatment, but also counseling and psychosocial types of treatments. And we need to improve jail discharge. There's a very good program out of Stearns County called the RAP program, which stands for Release Advanced Planning, where a group of volunteers that work for different human service agencies get together with volunteer inmates who are looking for a good human service discharge plan so they can hit the ground running when they're discharged from jail. So some of the common legal terms and issues that we find when looking at mental illness in the criminal justice system is the competency to stand trial. That's a person's ability to assist in their own defense and understand their charges. When they don't understand their charges and can't assist in their legal defense, they are considered incompetent to stand trial, usually sent to a hospital type of setting until they're able to face the charges. The plea not guilty by reason of insanity, approximately 1% of all people plead not guilty by reason of insanity, and only about 1 out of 4 of those people are actually found not guilty by reason of insanity. And even when they're found not guilty by reason of insanity, they're usually sentenced to mental health treatment, usually in state hospital, forensic hospital settings, which oftentimes resemble prisons, and they're facing an open sentence, so they're often there longer than they would be otherwise. This insanity is based on the 19th century McNaughton rule, which basically means that if the person knew right from wrong at the time of their offense, they should face those charges and be found guilty. Or if they don't, then they should not face those charges and found not guilty by reason of insanity. Some states have guilty but mentally ill pleas, which states that, yeah, I'm guilty, but I have a serious mental illness and I did know right from wrong at the time of the offense, but I would be much more benefit to be treated in the mental health system. The Tarasoff, which is a duty to warn, which basically states that if somebody tells me that they're going to hurt somebody else, I have a duty to warn that person and inform the police.